I think physicians who prescribe these medications, which are very effective medications, should be aware of this element of risk. And there are already guidelines coming out of the European Calcified Tissue Society where they say that the analysis has been correct. So what needs to go out as a recommendation for clinicians is that when you are going to discontinue denosumab, and the safety of denosumab has been shown out to be 10 years. So that's pretty long term. If you're going to discontinue it, you want to overlap it with another anti-resorptive with a prolonged half-life, for instance, a bisphosphonate. So you don't have that, that immediate loss that is going to occur. You're going to preserve that from happening. Denosumab is number one. It's been out since 2010, and we have 10 years of data that is very well gathered from the FREEDOM trial, the FREEDOM extension. In terms of the recent publication, in terms of safety, that safety was excellent. In fact, the safety issues that were raised in the first 3 years have gone down with time to the point that they're not much greater than the background noise. And there was just one case of atypical femur fractures in like 2,500 women. In ONJ, I think there were 7 cases. That is very commensurate with what we would expect. And I like it particularly because it's the only agent approved for prevention of fractures in cancer survivors. And that is a population that is large and growing considerably, and many of them are seniors. And so denosumab has been shown to reduce fractures in women starting aromatase inhibitors by 50%. And then it's been shown to reduce fractures in men who start androgen deprivation therapy by 65%. So those are some very solid, very good numbers in these very high-risk populations. The other one is romosozumab, which is just recently been approved. Romosozumab is used, as we discuss in the specialty boards, we are going to use it for patients who have probably failed first-line treatment. It is an anabolic. It's going to be given as a physician-supervised medication, which always gives better results because patients' adherence not very good. So having it supervised is good. The duration is only going to be a year. That's because after 12 months they generate neutralizing antibodies. But the anabolic effect that it has, and also inhibiting resorption at the same time, gives us a dual effect of rapid increase in bone mass. It certainly has a place in a specialist armamentarium for osteoporosis.